So what I want to show you is just a little bit more in depth about that topic. So this was a paper published recently, Mechanisms of Damage to the GI Tract from Non-Steroidal Anti-Inflammatory Drugs. You can see down here, NSAIDs, or non-steroidal anti-inflammatories, interact with phospholipids and couple mitochondrial oxidative phosphorylation, which initiates biochemical changes that impair function of the gastrointestinal barrier. That barrier is what protects you from leaky gut. The resulting increase in intestinal permeability leads to low-grade inflammation. I think it's important that we circle that word, because what is causing the pain? What's driving pain in the first place? Pain is inflammation. It's very important that you understand that. And inflammation can cause a lot of issues, but predominantly it is an inflammatory process that leads to the perception of pain. And so here we are, we're talking about one of the very mechanisms of actions of drugs used to treat the pain, creating inflammation directly. We can also see here NSAID inhibition of cyclooxygenase enzymes along with luminal aggressors. Luminal aggressors would be things like bacteria, poop, LPS, results in erosions and ulcers with potential complications of bleeding, protein loss, stricture formation, and perforation. So what is bleeding? Bleeding causes blood loss. This is one of the reasons why we lose iron. This is one of the reasons why iron deficiency is a side effect of non-steroidal anti-inflammatories, because you're actually bleeding internally and don't know it, and that blood comes out in your stool, but it's already turned brown because it's oxidized by the time it hits the toilet. So that's that complication of bleeding, but also a reduction of protein. Now, what are your muscles and joints made out of? How do they heal and repair if they do become damaged? You have to have protein as an element. That protein contains the special amino acids that are necessary for healing and repair of damaged tissue. And so if you are creating a problem where you're leading to protein malnutrition as a result of the very damage of the drugs that you're taking to treat the very disease that's creating the pain, again, you can see how you're trapped. You get stuck in this vicious cycle. And I want you to be able to avoid that cycle. Now, speaking of cycles, let's talk about what I call the grainflammation cycle. This cycle, because we talk about what to do about it. So here we're presenting a lot of the problems, right? Like using the drug to manage the pain is, in my opinion, the problem. Well, what is the solution? Well, number one, it's identifying why the pain exists. For many people, the pain exists because of grain. That's hence the grainflammation cycle. If you're not familiar with my work, if you're not familiar with my PBS special or my book, No Grain, No Pain, you should definitely check that out. We can put a link below and you can look more into that. But these concepts here, if you look at this funnel, you've got things like heavy metal, excessive omega-6, leaky gut, excessive carbs, mold, gluten, amylase trypsin inhibitors or ATIs, genetically modified organisms, and pesticides are all things that we know that come in grain. So grain contains all of these properties, and it's in big part, these properties lead to inflammation. Now, that inflammation typically is why doctors prescribe pain medications, because many of these pain medications, what do? They either block inflammation, like the non-steroidal anti-inflammatories and the corticosteroid drugs, or they affect you in a neurological way. So, for example, Tylenol and some of the antidepressant drugs and some of the anticonvulsant drugs affect neurological mechanisms that can suppress pain. So this prescription drug then leads to a reduction of inflammation, but it doesn't solve for why the pain exists, because it didn't take care of the things that were driving the pain in the first place. So now what you're doing is you're masking the pain. Well, back up to this diagram. When you have inflammation, one of the things your body naturally does is it makes more cortisol. Cortisol is your body's way of fighting inflammation. Cortisol from your adrenal glands, these tiny little glands that sit on top of your kidneys, make cortisol the hormone that helps fight inflammation, right? So when you're chronically inflamed, your adrenal glands will make more cortisol to try to help you out. When we make a lot of cortisol to deal with inflammation, or when we take prescription steroids, that induces muscle loss. It's a very known, very common side effect of chronic high levels of glucocorticoids or corticosteroids, is that we end up with muscle loss. Now, when we have muscle loss, you know, one of the side effects is our BMR, which is our basic metabolic rate, the speed at which we burn calories reduces. In other words, we start gaining weight, right? We're losing muscle. That leads to weight gain. But muscle weakness from muscle loss also increases pain. When we have muscle loss, we get or develop, you know, around the bend here, we get muscles tightening up. They're shrinking. They're atrophying. And so what do we get? We get joint compression. And when we have joint compression, when we go to walk, when we go to move, that increases our pain, right? And when we have pain, what do we do next? We stop moving. Most people guard from pain, so they are less active. They're sitting more. They're protecting themselves from activating that pain. This is especially true if that pain is in a joint or a muscle, because joint and muscle pain typically are increased in the areas when we move them. So we develop this kind of protective mechanism where we've either stopped moving altogether, and when you stop moving, what happens to muscles? They continue to waste further. So you get stuck right here. Muscle loss, weight gain, more pain, more atrophy, more weight gain, and you just stay stuck here. Well, the process of weight gain as well is also inflammatory, because a lot of that weight that we gain when we become sedentary is an inflammatory type of fat, and it's fat that stores around your heart, it stores around your viscera, and that type of fat increases the risk for strokes and heart attacks and other health issues. But again, this cycle is normal unless we do something to interrupt it. And so we can interrupt it up here by changing our diet, changing our lifestyle, right? There are a lot of things that we can do. We'll talk more about that in just a minute. But again, cutting grain out is one fantastic way to reduce overall pain. We've got case studies of people that within a week, within 2 weeks, had no more pain. Years of chronic pain, 10 years, 20 years of chronic pain, changed their diet, and within weeks, the pain is gone. So all that being said, I want you to understand this mechanism. We come back over here. The other thing that I want you to understand about cortisol, because again, this is one of the common drugs that doctors prescribe, is taking this drug over long periods of time chronically increases blood sugar, which increases the risk of diabetes. Diabetics don't heal, or they don't heal efficiently. And so they end up then developing other problems, and one of them is nerve pain. Then they go on to develop neuropathy or nerve pain, and now they're being treated for nerve pain too. And so this is when, you know, pain management sets in. Now they've got this physical joint and muscle pain, then they've developed this long-term blood sugar problem that's led to nerve pain, and now they're being managed for nerve pain, and the nightmare never ends. You can see here excessive cortisol interferes with vitamin D, calcium, and magnesium, which we've talked about. We talked about a moment ago. It also, that lack of movement, when we stop moving, that lack of movement reduces the cerebrospinal fluid flow. Remember, part of movement is that it is a pumping action. When you walk, your spine is moving, and that pumps the cerebrospinal fluid movement around your brain. It helps your brain to detoxify. And so a lot of people that when they stop exercising and stop moving, their brain starts to deteriorate at a faster rate, increased risk for things like dementia. We also know that pain medications, you know, again, don't stop the influx of grain-based poisons, come with a plethora of detrimental side effects to include, as we've already talked about, death, addiction, intestinal erosion and leaky gut, and then nutritional deficiencies. These very nutritional deficiencies recreate this cycle ad infinitum, ad nauseum, and you're stuck. So don't get stuck. Now, let's talk about some additional things here I want to point out. So I mentioned earlier that corticosteroids cause muscle wasting. And so a lot of people challenge that, but I want to show you this, just a research study published a few years ago. Patients treated with corticosteroids for various disease states such as arthritis, asthma, and chronic obstructive pulmonary disease. So remember, steroids also include your steroid inhalers, not just steroids for pain. Frequently suffer from muscle wasting as a side effect of the treatment. Okay, so this is a commonly known medical side effect of using those drugs long term. And as I asked earlier, how many of you, when your doctor prescribed that drug, told you that a side effect of that drug was that your muscles were going to start shrinking and wasting and creating more of a problem? Again, we'll look at those comments and see how many of you answered yes to that. Okay, let's look at this study here on Diclofenac. Now, Diclofenac, this is a type of NSAID, non-steroidal anti-inflammatory drug. And so a couple of studies on these types of medications, non-steroidal anti-inflammatories, where they looked at, in this case, it was called the Dolor study, Dolor Spanish for pain, but it's kind of unique the way they make these acronyms. But aside, lumbago means low back pain. And so Dolor means pain, but this study, what they found is that when they combined Diclofenac, which is an NSAID, with B vitamins, the outcomes were superior than just using Diclofenac alone, right? And so they compared. They actually did two arms in this study where they said, okay, we're just going to give patients non-steroidal anti-inflammatories for their pain, or we're going to give them non-steroidal anti-inflammatory with B vitamins. Well, the B vitamin group did better. Why is that important? It's important to understand because you need B vitamins to deal with pain. B vitamin deficiency can contribute to pain, and this is one of the things, again, most doctors won't have a conversation with you about. When you go to pain management doctor, they're not handing you a B complex and saying, let's try this first. They go straight for the big guns. So this is another study on Diclofenac, administration by B vitamins. You can see here in this study, the results document the positive influence of B vitamins on painful vertebral syndromes and indicate that B vitamins contribute to saving of NSAIDs by shortening the treatment time and reducing the need for the NSAID. In other words, the B vitamins work so well that they reduce how much of the NSAID the patient actually needs. So think about that in terms of how many people could need less of those types of drugs and get less of those types of symptoms associated with those drugs. And in this case, it was B1, B6, and B12 that was being used. We know that B12 deficiency can cause chronic pain. We know that B6 deficiency also is associated with pain. We know B1 deficiency, because of its role with acetylcholine and the nervous system, regulates how we interpret pain in a large way. So again, these B vitamins, very important, and research kind of shows that and backs it up. Now, I want to pull up this as well. I thought this would be important to show you. The role of vitamin C in the treatment of pain. You see here, a number of recent clinical studies have shown that vitamin C administration to patients with chronic regional pain syndrome decreases their symptoms. Acute herpetic and post-herpetic neuralgia. This is chickenpox, okay? Or in some cases, doctors call it shingles, but it's post-herpetic neuralgia is the fancy way of saying it. Vitamin C administration also diminished pain in these patients. Furthermore, cancer-related pain is decreased with high-dose vitamin C, contributing to enhanced patient quality of life. Overall, vitamin C appears to be safe and effective adjunctive therapy for acute and chronic pain relief in specific pain groups. I think it's important that you understand that for a couple of different reasons. Number one, NSAIDs, as we said before, reduce vitamin C. Steroids also reduce vitamin C. Go back to what we've already learned. These are two of the most common medications prescribed for the management of pain, and both of those medicines reduce vitamin C, and vitamin C can reduce pain in people that struggle with chronic pain syndromes. As a matter of fact, in my practice, vitamin C is one of my favorite things to use at high doses for people that struggle with chronic pain. 5 grams or more per day is where I generally start people who are in chronic pain. We also add to this combo, we add quercetin, generally 2 to 4 grams per day. In many cases, one of the ways I help people wean off of these medications is with this combination. So if you find yourself there, talk to your doctor about that combination and what it might be able to do for you. Something else I wanted to point out is this study on the supplementation of vitamin D and calcium in patients suffering from chronic nonspecific musculoskeletal pain. And you can see here the conclusion of the study: supplementation with vitamin D and calcium decreases chronic nonspecific musculoskeletal pain. Again, let's tie that back to what we just said with steroids. Not so much NSAIDs here, but steroids reduce vitamin D and they reduce calcium. We said that earlier. And here we have research showing that using calcium and vitamin D reduces nonspecific musculoskeletal pain in patients. So if you're being treated for nonspecific musculoskeletal pain with a steroid that's depleting vitamin D and calcium, you could be making the problem worse. So again, I'm trying to draw a lot of inference for you guys on the loops, the kind of progressive loops of futility that medicine commonly throws at people when they're dealing with chronic pain. The pain management is probably one of the most archaic forms of medical treatment today because they don't respect nutrition. They don't understand that the very drugs they're trying to use to treat the issues are the very things that are potentially perpetuating the issues.